Good evening, and thanks for joining us for this update from your coronavirus headquarters. I'm Mel Meyer. Nearly 750,000 Americans have now tested positive for the coronavirus, and over 41,000 have died. Federal health officials say they're closely watching outbreaks in Massachusetts, Chicago, and Ohio. This as protests to end stay-at-home orders are taking place in many states. Meg Oliver reports from Newark, New Jersey.
As morgues continue to overflow in New York City, these construction workers have been deemed essential in order to construct shelving for dozens of refrigerated trailers. Still, New York's daily toll of coronavirus deaths hit its lowest point in more than 2 weeks. And the state's governor announced an antibody testing survey will begin Monday, a first step in an effort to reopen the economy.
I know people are eager to get on with life. We have a very small margin of error here as we navigate going forward.
But protests pushing back against stay-at-home orders ramped up over the weekend in about a dozen states, and more are scheduled for Monday.
It's the flu. The people who have poor health are always the most vulnerable. God bless them.
Protesters say they're encouraged by President Trump, who has accused some state governors of going too far with stay-at-home orders. Last week, he tweeted, "Liberate Minnesota, Michigan, and Virginia." But some Republican governors say the president is sending mixed messages.
The president's policy says you can't start to reopen under his plan until you have declining numbers for 14 days, which those states and my state do not have. So then to encourage people to go protest the plan that you just made recommendations on Thursday, it just doesn't make any sense.
U.S. Treasury Secretary Steven Mnuchin expects the White House and Democrats will reach an agreement Sunday on a new $450 billion stimulus plan to boost the now drained loan program for small businesses, help hospitals, and increase testing.
That'll be a terrific impact on small business, and it'll also cover unprecedented program of $25 billion for testing.
The stimulus plan could go to the Senate Monday, the House on Tuesday, and the president's desk for a signature on Wednesday. Meg Oliver, CBS News, Newark, New Jersey.
A New York Times reports the CDC admits to breaking protocol in the nation's first coronavirus test. The first tests were contaminated, delaying the federal government's efforts to control the outbreak. Taking a look at the latest local numbers, more than 4,300 people in Wisconsin have tested positive for COVID-19, and more than 200 people have died from the virus. In area counties, there's one new case being reported in Jackson County. Today, La Crosse County has not reported a new case of the virus in more than a week. And 23 of the 26 people who have tested positive in the county have since recovered. There are now more than 2,300 positive cases across Minnesota, and there have been at least 134 deaths. There are 61 cases being reported in Winona County and 10 deaths, which is up 2 from yesterday. Houston County still has just 1 case being reported, and in Iowa, 36 cases are being reported in Alamakee County and 6 cases in Winneshiek County. The entire state now has more than 2,900 people who have tested positive. That's up from 2,500 yesterday. 75 people have died in the state. As the number of new cases and deaths continues to rise in Winona County, health officials say some area nursing home residents are being moved for their own protection. To date, more than 90 nursing homes in Minnesota have positive cases for COVID-19. According to Winona Health, Sauer Healthcare was identified by the state as one of these facilities. Now, staff at the nursing home are moving residents who have tested negative out of the facility to keep them safe. Winona Health's CEO, Rochelle Schultz, said they have created a plan to move those residents to Lake Winona Manor for an interim stay. The long-term care facility has a distinct, separate unit that has not been in use. Winona Health says that's important to monitor and evaluate the health status of these residents at a quarantine level of observation. A team from the Centers for Disease Control and Prevention arrived this week to work with staff to assist with this plan. Many of us are frequently washing and sanitizing our hands, and that's a great thing. But some people are seeing negative effects because of it, like dried skin and irritated skin. Health experts say the products you use could be part of the reason. Hand sanitizer is a big contributor because the alcohol dries out the skin. So when you can, choose soap and water instead and try to use gentle, unscented soaps and lotion. One health expert says if a product is bothering you, just get rid of it.
The rule of thumb is if you start using something and almost right away you start to have a rash from it, you really shouldn't use it anymore. Really, you shouldn't, because it could get a lot worse the more often you use it.
So if the irritation does get worse, they recommend using an over-the-counter cream like cortisone, but if it doesn't get better after a few weeks, you should call your healthcare provider. They might be able to prescribe something that works better for you. Thanks so much for joining us for this coronavirus update. You can always get the latest anytime on our website at news8000.com or download our mobile app. We hope you can join us tonight at 10. Take care.